I thought I'd give an update. It has been about 9 months since my partial knee replacement, and I thought I'd give an update about how things have been going. For those of you who don't know, I had a partial knee replacement, and after a meniscus injury that occurred about 5 or 6 years ago, it was a tear, and at that time, I had a partial meniscectomy, so I had part of the meniscus removed, and that accelerated some arthritis in my knee. To treat it, I had the injury for about 3 or 4 years, and I tried replacing the damaged meniscus with a cadaver graft, so like a piece of cadaver meniscus to help replace that. And if I would have done it immediately after my meniscus injury instead of having the partial meniscectomy or the removal of the meniscus, I think it would have worked. But since I had been about 3 years or so, the muscles in my knee had started to cave in on that part, and there wasn't any space for it. So when they put in the cadaver graft, my knee actually ground away at that meniscus pretty quick. And after about a year or two, there was arthritis already setting in, and the meniscus was sort of gone. So the meniscus is that cushion in between the knees. And at that point, I had only a couple options. One was to get a partial knee replacement, where the damaged part of my knee, they would just remove that and replace it with titanium and put a plastic spacer in there, um, and or a total knee replacement where they would remove both the good and the bad parts of my knee, like all of the bone, all of the cartilage and meniscus just removed, including all of the ligaments, and replace that with titanium and plastic spacer. Um, I looked around a lot, and I decided to do the partial knee replacement, partly because the recovery is a lot faster, um, and also I get to keep all of my ligaments that are inside my knee. So that means I could still run. I could still do like cutting action. So like if you're playing tennis, and you change one direction to another, your ligaments help your knee to stay stable. So that's something that was important to me because I like athletics, I like sports, so I wanted to be able to continue to do that. Um, so far, it's been doing well. I would say when I first started this process, when I started with the physical therapist, my knee, the strength of my knee, even before the surgery, because since I hadn't done any running or jumping for like 5 years, was probably like 65% of my non-injured knee, just because I've been babying it for years. And when I looked at my thighs, I could see the quad muscles on my affected knee. The injured knee was definitely smaller than my right knee. You could just see it. Right now, I would say the strength is about 85% of my non-affected knee. Um, I have completed physical therapy, and this is something I tell all of my patients. After physical therapy, I have continued to do the home exercises. I continue to do. I don't skip leg day. It is probably like it is as important as any other exercise. I do a variety of different exercises focusing on the medial quad, lateral quad, hamstrings, calves. I do lots of stationary bike. I do probably like 30 minutes of stationary bike at different levels, like quick and high level and standing, to get as much of a workout on that quad as I can. But also, um, for me, I do a lot of hamstring exercises. I think that's a big thing to help with evening out the strength on both sides, because there's so much weakness in this and my affected knee compared to my good knee. Um, I can run short distances. I don't have any pain. I haven't actually had pain for like several months, which is great. Normally, I would have at least some twinge or grinding sensation, but now I haven't had anything. Sometimes I'll get something um, if I have pushed myself athletic wise too much. But most of the time, I actually just feel fine. I can run. I've been able to do Brazilian Jiu Jitsu at my normal level. Probably the main limitation I have is my knee can extend completely, which is very important. Sometimes it's a weakness that your knee can't extend it completely after a surgery like that, but I can extend 100%. But when I flex it, I'm probably like if I kneel down, I can't get my butt all the way to my heels on my left side. It it's probably about like maybe 3 or 4 inches away. Nothing that limits my activity, but it's only noticeable because Brazilian Jiu Jitsu, having flexible knees is a good thing. And so I've had to modify that. Also, because of the weakness in my knee, I've had to modify my judo. Those of you who don't know, it's a lot like wrestling. And so having a side maybe that I prefer, I have to sort of move my body a little bit differently. So that's been something I've been working on. But overall, yeah, I mean things have been good. I haven't had any major limitations besides those really extreme examples like judo and Brazilian jiu-jitsu, and the fact that I can't do a marathon yet. Those are pretty much it. But if I needed to run around the block or chase my kids, I definitely wouldn't have a problem with that. Uh, Gym, I could do almost all the exercises at the gym, so it's not a big deal. And overall, it's been pretty good. I hope after a year, this knee will move from 85% to 100% compared to my right knee, and I think that's the goal. No numbness issues, a little bit of numbness around the scar area, but that's to be expected. Otherwise, I've been doing well. So, anyways, I thought I'd give this update. If anybody has any questions about partial knee replacements or they want to know some experience that I had, leave a comment below. I definitely will respond to it. I know that for some people, it's a big decision for sure, and surgery is always a big decision. So hopefully, I can help uh, yeah, anybody with any questions that they have. All right, thanks.